My name is Adam Best. I'm 53 years old, and over the past 18 months I have had significant issues with my shoulder, in that I could not raise my arm above my head, I couldn't reach into a cupboard, my quality of life was declining very quickly. I was recommended to come and see Dr Usama. He gave me an indication that I required a replacement shoulder, a shoulder implant.
Mr. Adam has been referred to me from one of the colleagues for his left shoulder problem. He was suffering from left shoulder pain and restricted range of motion for a long time, and he was not able to go back to his sports activity. After a discussion with Mr. Adam and after reviewing his clinical case and reviewing all the images, we offered him the second option of treatment, which is the total shoulder replacement.
Following my surgery, I came back and saw Dr Usama, and we went through my recovery and how that was going to work and the physio that I was going to require. I've been having ongoing physio for the last 6 months every few days, and the quality of life and the ability to move has increased significantly.
The procedure done for him went very well, and he has good improvement after the surgery. He is almost back to his sports activity, and he has no more pain, and he has a very good range of motion of his shoulder. We are so happy for the outcome he received from the surgery.